This video presentation is designed to introduce you to NecroSeal OD and demonstrate its proper application. NecroSeal was designed specifically to seal cadaver tissue following skin recovery and works by forming a clear film which bonds to the tissue and prevents fluid from seeping through. NecroSeal comes in a single-use pouch containing everything you need to seal a cadaver following tissue recovery. Inside, you will find an absorbent, protective, poly-coated mat. NecroSeal is a rapidly setting adhesive, and the mat gives you a place to rest product components without gluing them to the table or tray from which you are working. Place the shiny, poly-coated side of the mat down so that the absorbent fabric is on top. 2 applicators are also included in the NecroSeal OD pouch for your convenience. However, 1 applicator is usually sufficient to complete sealing the recovery area. The snap top bottle holds 20 milliliters of NecroSeal. When using NecroSeal OD, please remember the following safety precautions. Always wear gloves while using NecroSeal OD. Gloves will prevent you from gluing fingers together or gluing yourself to the product components. Because NecroSeal will cause rapid adhesion between most surfaces, any unintentional contact with skin, clothing, and other surfaces should be avoided. Always wear eye protection when using NecroSeal OD. In fact, do not allow NecroSeal fluid to contact any mucous membranes. Avoid allowing NecroSeal to contact bleach-based chemicals such as dispatch. The NecroSeal liquid reacts strongly with bleach, and contact with bleach will prevent a good seal from forming. Please also refer to the written directions before using NecroSeal OD. Once you have completed tissue recovery, blot up any moisture or fluid on the recovery area with gauze or a paper towel. Excess fluid on the tissue will diminish the effectiveness of the product and may prevent a strong seal from forming. Once this is complete, you are ready to apply NecroSeal to the recovery area. Squirt small beads of NecroSeal onto the recovery area and immediately spread the liquid thoroughly, covering as large an area as possible. The most important factor in achieving a successful seal is applying the product in a thin coat. Because of the way NecroSeal cures, thick coatings are less effective than thin ones. Simply continue this process until the entire recovery area has been covered. Be sure to overlap the borders of the area from which skin has been taken. This will ensure that the seal is complete. NecroSeal is a liquid which will run freely. Apply only a little at a time and exercise caution not to allow any liquid to run down the sides of the body, as it will glue the body to the table. Avoid allowing the NecroSeal liquid to pool. Should a pool develop, continue to spread the liquid until a thin coating has been achieved. NecroSeal will set and dry quickly. You are likely to notice that before you finish sealing the entire recovery area, what you coated at the beginning will already be dry. NecroSeal can also be used to seal areas in which incisions or wounds have been sutured. Apply the liquid in the same way, spreading it thoroughly until a thin coat over the wound or incision edges and suture holes has been achieved. Again, avoid allowing the liquid to pool, especially inside the suture holes. Any product components which have come into contact with biohazardous materials should be disposed of in accordance with standard biohazard disposal procedures. Do not empty leftover NecroSeal into any drain or sewage pipes. It is very likely to cause a blockage. NecroSeal will last longer if stored in a refrigerator or freezer. However, it is important to allow NecroSeal to warm to room temperature before applying, or the liquid will cure very slowly.